Okay, let's go ahead and finish this particular section here. This is talking about the components of the medical record. Again, we talk about the demographics, and when we talk about demographics, talk about where the person was born, their address, allergies, um, anything that they are allergic to, whether food, any past experience that they've had with allergies. It could be something that is on an annual basis, such as hay fever, or allergic to peanuts, or allergic to pollen. Medical histories that includes previous illnesses, surgeries, prescriptions, any type of medication. Medical orders that have been written by the physician for the patient's medical records. And then we have medication administration record, and this is either handwritten or computerized, and form that tracks the medication given to a patient, what time they were given, and who administered it, and any type of lab test. Lab test is also very, very important. This could be a blood sugar or drug levels, could be a radiological exam, such as X-rays, blood culture, a microbiological test, and other specialized tests such as a biopsy. It's also noted within the medical records. Then there's a separate section called document flow sheets. These are forms that are filled out by the nursing that track the patient's vitals on an hourly or scheduled basis, hour rates, a large volume, and medication drips, ventilator settings or other respiratory support, patient intakes, urine output, pain scores, and other nursing notes. And then you have the progress notes. The progress notes that detail the current progress of the patient and include any patient complaints, laboratory data, physical exams, findings, overall assessment, and plans for the patients. And these progress notes are usually written by the physician while the patient is in the hospital, but it could be added on to other healthcare professionals, such as for nurses, social work, or pharmacists, etc. Okay, so these are the components of the medical records that you usually see, and you should be familiar with. Okay, let's talk about the medication orders. So here we're talking about the components of the medical records. Here we're talking about the medication orders that you may find as recorded within the medical records. And there are different types of professionals that have authority to write medication orders in a pharmacy setting. Most usually it is the physician, but both nurses and pharmacists can write orders if they are directly interested to do so by the doctor in person or over the phone. These are referred to as verbal orders or telephone orders and must be co-signed by the physician who approved them. And some hospitals, specialized healthcare providers with advanced training, can write orders without the signature of the physician. These include physician assistants and nurse practitioners. In the hospital, all written orders for patients are done on a medication order form and not a prescriptive blanket seen as common community pharmacy. So this is one of the differences that you may see. And you can always go to the web and put in medication order forms, and you can see that they're different than a prescription. So medication order forms are an all-purpose communication tool used by various members of the healthcare team. Right. So many different things can be written on it. It could be laboratory tests, X-rays, in addition to medication order. Right. Unlike a prescription, which is only a prescription form that's written on it. Okay. An alternative to the traditional written order is computerized physician order entry. And CPOE is a system in which doctors or agents of the doctor enter orders directly into the hospital computer system. And this allows for the elimination of certain errors that may occur with handwriting. And then, because it's electronic, can expedite the order to the pharmacy lab or different units that's found within the hospitals. And there are different types of orders that should be noted. So again, looking at the definitions, CPOE, a system in which the physician or agent of the physician enters order directly into the hospital computer system. You have MARS, medication administration record, a form that tracks the medications administered to the patient. You have PRN order, an order for medication to be administered only as needed. So those are different definitions that you should be familiar with in relationship to medication orders. Okay, again, all written, I probably should emphasize the written, but all written pharmacy orders for a hospital patients are done on a medication order form. All right, and we just finished talking about computerized physician order entry. Is an electronic alternative to the medication order form, and more hospitals have been moving towards that. If you go to many hospitals today, the residents, the physicians, the nurses, they all carry some type of tablet. And again, the goal is to try to decrease the amount of paper that is necessary. Type of medical orders, we talked about this. Standing order, patient receive medication at scheduled intervals. For example, 1 tablet every 8 hours. You have a order as needed, or given as needed, or PRN order. Medication administered only on an as needed basis. For example, usually dealing with pain. For example, 1 tablet every 4 to 6 hours as needed for pain. And then there's a stat order. This is order then the medication must be administered immediately to the patients. Usually some type of cardiac medication, the heart are working together, etc. Okay. Other types of medication orders are either restricted medications or stop orders. When we talk about restricted medications, these are medication orders require approval by a specialty service, such as infectious disease before processing. Or there could be some protocols that also restrict which physician or medical service can place an order for a medication. For example, a chemotherapeutic agent. Some hospitals have only oncologists, those who have gone through their oncology residency and certified, have completed an oncology residency, has the right to prescribe chemotherapeutic agents because they will know best how to use it. It could be an infectious disease, like a particular type of antibiotics such as vancomycin, that may be limited to a physician who has completed residency in infectious disease. Right. Stop orders. Order limited to a certain amount of time. After 7 days, you see that a lot with many of the antibiotics, after which a new order is required to continue with the medication. Here is a very good example of the record keeping that you may find in a particular hospital. So medication administration records, nurse records, and track medication order using a medication administration record, or MAR. The MAR may be written or computer generated form, or may be electronic. The MAR record records every medication order for the patient over a 24-hour period, as well as the time the medication was administered and the person who gave the dose. Okay, so as you look at this particular chart here, you see you have where is this person is located in the hospital, name, if there's a particular hospital general account number, male or female, age, the doctor, any type of allergies that person may have, the time the person has been in the hospital, the diagnosis of the disease, height, weight, and then the possibly the admitting nurse or the nurse supervisor that's on that particular unit. And then here is the medication that is prescribed to that particular individual. Notice the date and the time. Oh, sorry. Yes, notice the time. Okay. Remember we talked about the different times. So this would be 7:30 in the morning, and this would be 3:30. This would be 4 o'clock, going down to 10 to 11 p.m. So this is the time. So this is when the medication is supposed to be given, and this is the initials of the individual who gave the medication. Okay, so we have already defined standard order as a standard medication order for a patient to receive medication at a scheduled interval. As that order, an order for the medication to be administered immediately. So order entry into the computer system may be performed by the unit clerk, pharmacy technician, pharmacist, nurse, or the prescriber, usually a physician. The technician must also be aware of any specialized protocol the hospital has in place in regards to restriction, medication, and automatic stop orders. The hospital technician plays a very important role in assisting the pharmacist in making sure a medication and its dose are appropriate to each individual patient. And the pharmacy technician may also screen medication orders for any that seems inappropriate. So again, just like in the community pharmacy, pharmacy technician plays a very important role within the hospital pharmacy setting. Okay, let's go ahead and take a look at the ordering process. Once a medication order is approved by the pharmacist, the order needs to be fulfilled. So it's something that is not delayed. Since many medications look similar and the same drug may come in several different doses, the technician must be vigilant in making sure the right medication and dose are being filled. After the medication has been prepared, the technician must prepare and initial the medication label. In most states, medication must be checked by the pharmacist before being sent to the nursing unit. And we talked about that in the community pharmacy. But the final check before it goes out to the patient, and making sure that everything's fine, sign off, is by the pharmacist. Okay, medications may be delivered to the patient care area, and there's many ways that is done. Let's see, the central pharmacy is on the first floor. The oncological clinic is on the fourth floor. Depending on the hospital, the pharmacy